You're rehabbing your ankle wrong, and it is quietly making you weaker. So here's what to do instead to heal even stronger. All right, hanging onto this chair if you need to for balance, we're gonna start by tapping that toe forward as I bring that leg out. So we're working on what's called plantar flexion, and oftentimes all of the motions the ankle does start to get stiff and not work very well. And that actually leads to some of the pain. So we want to try to move in ranges that feel good for us, obviously. Not no pain, no gain, right? So we're going to do 10 on each side, then we're moving on. So again, if you just need to just kind of do that instead of pointing, it's not a problem. I've totally lost count already. One of those things you guys probably have realized if you do follow me. I'm trying here. We're going to keep going. We're going to do the opposite of this motion when we're done with this one. You don't have to hang on to that chair either unless it feels like I said, you're going to lose your balance. Obviously, we're working both sides here. We're going to do one more on each side, and then I'm going to go and I'm going to do a heel dig as I bring those toes up to me. So this is going to stretch the calf muscles a little bit, really get some mobility going, but also dorsiflexion, which is that bringing the ankle up, so opposite direction of what we just did. You can bend that standing knee a little bit to help bring you out there. And again, we're gonna go for about 20. Pick up that pace a little bit if it feels good. Get that heart rate up a little bit too. Here we go. 6 more to go, and then we're moving on. There's 1, 2, 3, 4, 5, and 6. Okay, standing on one leg so we can balance, obviously. That's great for the legs, but if you need to, hang on. We're gonna get ankle circles. So now we're warming up some of the other motions in that ankle as well, working those hip flexor muscles too, because we're holding that leg up. We're gonna do 10 in each direction. Snap, crackle, pop. As long as that doesn't hurt, it's actually a good thing. Keep that in mind with all these exercises. It may feel like it's a little stiff, or maybe it's a little hard to move, but you should never feel intense pain, and always check with your doctor first if you're questioning something. Couple more, and then switching feet. Here we go. And you may, it's one of those, I have a patient that calls these stupid, how I can't remember. There's definitely stupids involved in there because it's stupid simple because they don't seem like they're working that much, but the leg gets a little tired by the time you're done. Apparently my brain might be stupid simple today too. Switch directions. Again, try to get as big of a motion as you can using just that ankle. In other words, not the whole hip. And you may notice a difference side to side, and sometimes it's not even the injured ankle. Maybe you've worked on that a little bit. Ooh, you want to make sure that both are doing what they need to do so that you don't injure something else. One more. Okay, we're going to go right up onto those toes. You can use both hands if you need to on that chair. One hand or no hands. And really nice and slow on the way down. If this is too easy for you, you can go ahead and switch to single leg. We'll do 20 total, so that would mean you do 10 on each side. So there's 6. I'm going to stick with both legs today. 7, 8, 9. Maybe I will hold on. 10 more to go. 10, 9, 8, 7, still snapping and cracking there. 6, 5. Again, only go up as high as you can onto those toes. 4, 3, 2, and 1. Okay, coming away from the chair, bring those feet about shoulder width apart. We're going to go down into a little squat. They're just little mini squats. This obviously works those leg muscles, but we're also getting that dorsiflexion in a weight-bearing position, which we need when we walk. So kind of an important one. Again, you're only going down as far as you can to make sure your whole body's comfortable, quite frankly, but certainly that ankle. If you start to do this and you go down too far and maybe that heel wants to lift, you're going down too far. Keep that weight even there. We're going to do 15 of these. You may find that you can go a little bit lower as you go. And I'm using my arms. It's almost like I'm skiing because it's almost winter here. May only be October, but it really is almost winter here. 3 more to go. 1, 2, and 3. Okay, we're gonna now take it out to the side, one more strength, and then we're gonna end with just a little stretch. So you're gonna start by just going into a little bit of a lateral lunge. If you can't go down far, again like this, that's okay. Make sure that you're sitting your butt back just like you did in a squat. Now we're using the outside of that foot a little bit. The most common ligament to be injured is your ATFL, which tends to be on, well, not tends to be, it is on the outside of that foot. And so this is an area that often is missed a little bit in weight bearing, but absolutely needs to be strengthened to keep your body stable. If you can go a little deeper, go a little deeper. You got to stretch on the other side too. Again, of course, listen to your body. Just 10 of these. 9, one more. And of course, switching sides. I don't want to hit my chair, so I'm going to move over just a touch and down. And you'll probably notice this is my ankle that I've injured many, 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 many times. I don't have the same range of motion, but it's something I'm constantly working on to keep as much range of motion as I can. So again, keep that in mind for yourself. You may not be able to get to do what somebody else is doing, but you can always get to a little bit of a better point, right? There's no one spot you have to be. 2 more. And 10. Okay, one last stretch and then we'll call it a day. You're gonna go back into that position actually that we started in the beginning. I'm stretching the calf and the hamstring here, so I'm just gonna shift my hips back as far as is comfortable to get a nice stretch in there. Try not to round forward. The hamstrings attach right down into that hip, not into the spine. So that's the part we want to make sure that we're pressing into. One more breath. And then go ahead and switch sides. Bring those toes up towards you. You can bend that back knee a little bit if that feels okay too. Now we're working the ankle on the other, in the other side too. See, my balance sometimes isn't great either. And also don't worry if these vary day to day. Again, listen to where your body is at. One more breath. Hopefully you feel better.